What's going on, my people? What's going on? It's your boy Monte Carlo, and I want to thank everybody for tuning in to another episode of the Big Picture IG Live podcast. We have a very good guest coming on this evening, and we're going to be talking about mental health. And I want people to just be able to just give the information to their friends, their family, use it for themselves, and just continue to be great. I hope everybody had a good weekend, and I hope everybody has a prosperous week. And we're going to wait for her to come in right now, okay? She just logged in, Miss Valerie. All right, and I'm going to accept her on the request. 1 second.
Hi.
Good evening.
How are you?
I'm great. How are you doing?
I'm good. It's been a long day, but I'm here.
Okay, awesome. That's what matters. First and foremost, happy International Women's Day.
Oh, thank you.
Yes, it's a beautiful thing, and it's also Women's History Month.
Yes.
So, that's also another beautiful thing, and it's good to see that you're doing something positive and that you are giving back to the people right now.
Thank you.
The beautiful thing. So let's get it going. Where were you raised? Were you raised in New York City?
Long Island.
Okay.
People always ask if it's New York City, and then I say Long Island. They're like, oh, but yes, Long Island.
Okay. So, how was it being raised out there in Long Island? What was it like for you?
Let's see. Growing up in Long Island, I guess when I was younger, I probably didn't really pay attention to it. But now in retrospect, being a Black woman living on Long Island, definitely dealt with a lot of racism growing up out here in Long Island. And I think now that I'm older and I'm more aware of certain things, I'm a little bit more hip to kind of what's going on and kind of, where I went to school, the people I hung out with and things like that. So, I mean, I had a decent childhood growing up in Long Island, but again, like I said, in retrospect, things were definitely not what it seemed growing up as how it is now.
Okay. Okay. Wow, it's good to see that you got past the racism thing, and that really never really ends. You see it more and more as you get older, and it just makes you stronger. How old was you when you knew you wanted to be a nurse?
Well, I am Haitian. My parents are Haitian, so they knew I was going to be a nurse since I was born. I kind of got pushed in that direction because I was always told that it would be, a good profession, a good job. So I kind of went into it in the beginning with that kind of idea that I'd have security within my field. But then, as soon as I started working, I got involved with mental health pretty early on in my career. And I kind of found my place where I kind of fit in and I belonged. And that's what I really fell in love with. And I ended up, pursuing my career in mental health and making that be, the focus of my nursing career.
Why was you able to relate to the mental health field? So I don't know if it was easily, but why was you able to? It feels like you related to it. You had a connection to it.
I feel like I had a connection to it. One, I was always very good working with the patients. I don't know what it was, but people always said, it takes a special kind of person to be able to work with people in that particular field. So that was one thing. I was just good at it. And I also got a lot of satisfaction when I would talk with patients or talk with patients' families and really be able to create an impact in their lives just by the simplest things. But then also, as I started getting deeper into it, I realized that there was a lot of people within our communities, my network, friends, family, that were dealing with either depression and anxiety. And, I lost a friend to suicide. A friend of mine, a good friend of mine, he jumped off a school building. And that at that point, it was like, oh my God, Black male, about to graduate from school, well-liked, popular. No one really had much of a clue or inclination to that he was going through something that was that bad that he would take his life. So I think for me at that point, it was really like, okay, our community needs help. You're good at this. You're good with school. start digging a little bit deeper and seeing if that's where your passion lies. And, you know, the more I got involved with mental health, the more I just realized how needed we are in the field, how needed it is to see people of color in the field so that people can trust you, and be more inclined to actually start seeking, you know, treatment and help for the things that they're going through.
Mm-hmm. Wow, that's deep. That's deep. I'm glad that you was able to get a connection and you know, be an asset to the community right now. So how is it? What's the challenges right now that you're seeing being, you know, a Black woman in the healthcare, you know, as a nurse practitioner?
I guess one of the biggest challenges, well, one, being a nurse practitioner in general, I think there's not a lot of education on what our role is like. So I think sometimes people, they know doctor, they know nurse, but they're not really too familiar with the nurse practitioner space.
Gotcha.
So as a nurse practitioner, our role and our scope of practice varies from state to state. In the state of New York, we can independently practice, and we can prescribe medications, control substances, diagnose, do the treatment plan, all those different things. But I think a challenge outside of that, being a Black woman as a nurse practitioner, is just getting challenged by, you know, people of different races. You know, I've several occasions have gotten challenged in terms of my intelligence surrounding certain things. And that has definitely been challenging, navigating that space and keeping it professional and not telling them how I really feel at that moment in time, and kind of just being able to pull back and understanding that, you know, ignorance is bliss. And, you know, sometimes people don't know any better. So we always have to do our best to try and educate, you know, as much as we can. So I think that has definitely been a very big challenge, kind of just being in the space, being more in a position of power within my patient's care, and being able to kind of just, you know, not let certain things kind of get to me, being Black and being in the position that I'm in mental health.
Okay. So being a part of the National Black Nurses Association, like what are the benefits of that, and has that helped you, like, dealing with those different obstacles?
Oh, the National Black Nurses Association is like phenomenal.
Okay.
It is a great place to network, to grow within your career.
Okay.
I think the first meeting that I went to, my mentor now, he made me come to a meeting. I didn't really want to go. I kind of wanted to just go to work and not get too involved in things, but he kept encouraging me to go. When I went, that was probably the first time that I was in a room full of Black men and women, doctoral degrees, master's degrees. I mean, the room was just full of Black excellence, and I was completely blown away. And I was like, oh, wow, like, I need to go and advance my career, because it was just so encouraging. So there's definitely a lot of benefits, a lot of networking opportunities. Obviously, me and you got connected through someone in the Black Nurses Association.
Oh, okay. All right.
And then honestly, just a lot of opportunities for different career paths. You know, yeah, just a lot of opportunities. It's definitely a good place to be.
Wow. So in this association, like, are y'all able to give back to, like, schools? Like, is there a connection to the community within that?
Oh, everything that we do is tied to the community. There's various different chapters for our chapter. A lot of the work gets done in the city. They do programs with the high schools in the Bronx, I believe. We do fundraisers. We do give backs during the holidays. There's so many different things that we're able to do. If you have an idea for something that's related to the Black community and you want to do it, they're open to it. You bring it to the table. If you want to organize it, you run it, you bring it to them, and they're more than open to doing that. So we definitely do a lot within the Black community through that organization.
Okay. All right. So that's very good, because I was interested in finding out, like, if y'all had, like, any mentorships for the young brothers and sisters in high school who may want to get into nursing or have that as a career.
That I have to get back on you on. I feel like we do, but I'm not exactly quite sure how that works. So I can definitely get back to you, and then you can share it with the people that are following, if they're interested in more surrounding that. Yeah. Okay.
That's good. All right. So for the people who will see this live and may want to get into nursing, or may already be in nursing, can you just let them know like how broad the field is.
Oh my God.
And the different areas, because like you just said earlier, people don't, I know me personally, I didn't know a nurse practitioner existed until maybe 2-3 years ago. I thought it was only you had a nurse, you had a doctor. I didn't even know a PCA existed, PCAs and the techs and all that kind of stuff. I didn't even know they existed. So can you just let people know the different levels of nursing?
Yeah, so that is one of the best things about going to the field of nursing is there's just so many different avenues in which you can take. You can be working bedside nursing, meaning like on the floor in a hospital. You can work in an outpatient setting. There's correctional nursing where you can work in a prison system. You can work in a school and do school nursing. Oh my gosh, it's literally so many different things. Air Force nursing, at one point I had dabbled in that idea. And then outside of that, you can do legal consulting for nursing. You can get real creative. There's just literally, there's just so many different ways in which you can exercise being a nurse. And then there's so many different specialties that you can go into. So you have psychiatry,
Gotcha.
got cardiology, neurology, urology, dermatology. Like, it's literally so many different avenues. So that's the good thing about it, because you can definitely find where you fit in. And I do encourage people to kind of explore, because what you might think you might want to do may end up not being what you want to do. So the only way you'll kind of find that out is obviously exploring different paths you can take, going to events or networking with different people within your field and getting to know them, talk to them, see what their day-to-day is like, see what their lifestyle is like, and see if that's something that aligns with something that you would want to do. But there's definitely a space for everyone within nursing if that's something that they're interested in.
Yes, because like yourself, you're into psychiatry. You have some that are just into medicine, things of that nature. So it's good that there's different areas, and it's just not you just be a doctor or a nurse.
Right.
It seems like, and then I know for myself, I see that there's more need for nurse practitioners in the hospitals than just doctors. So can you just explain to people why, and also explain to people the difference between a nurse practitioner and a physician's assistant?
Okay. So, I mean, when you look at a nurse practitioner, physician assistant, we both go to different type of schooling. So in order to be a nurse practitioner, you have to be a registered nurse first. And then you go and get your master's degree to become a nurse practitioner. So our schooling is different. As far as the PA, I believe they go through their own program. It's a program dedicated to becoming a physician assistant. We both can do a lot of the similar things, but there's different and rules based on how we can practice, whether we can practice independently or under a doctor. So a lot of similarity between our roles, but we are definitely prepared differently. And being a nurse and being prepared as a nurse, there's a different level of, I don't know. I get a lot from my patients. They like seeing the nurse practitioners because they feel like we listen to them, we care, we ask a lot of questions, versus maybe sometimes when they deal with other people, so it's a different type of approach. So I think being a nurse first gives you just a different type of perspective in terms of how you manage patients and how you deal with patients.
Okay, that's a beautiful thing. All right, so I want to get into some of the things that's affecting our community, the urban community. And if people have different questions that they want to ask, if we have the time, we can definitely answer them. So how do you feel about the stigma of Black men given a responsibility at an early age to be a head of the household and protector on like a single parent household?
Okay, I'm gonna give my take on it, and I want you to give me your take on it too, because obviously you're a Black man too. So I think it'll be good to hear perspective on both ends. But I think it is a lot of pressure on the Black man, obviously, to be head of the household really early on. You got to think a lot of our Black men, are incarcerated, are not here. There's definitely a lot of pressure that when the Black man is actually present in the household to perform. I think that a lot of Black men really do identify their self-worth with what they can bring to the table. And I think that's a little bit of a dangerous thing, because obviously there's so much more to a person who they are, what they are, their self-worth, than just what they can bring to the table. But unfortunately, I think within our culture, within our communities, we put a lot on that. If a Black man can't make money, he's a bum, he's lazy. If he can't do this, there's just a lot of negative stereotypes associated. And I don't think we've really created a space for Black men to feel comfortable, to be vulnerable, to you know, talk about how hard it is, because I think it's challenging being a Black woman, being a Black man, trying to run a household and trying to manage all these things. We don't really get a second to breathe or to just talk about how we're feeling. You know what I mean? So I love that you're doing this platform, this podcast, because I think these conversations help in alleviating some of those pressures for people and allowing them to kind of just start the conversation about, you know, their mental health. A lot of Black men are dealing with depression and are dealing with anxiety, and they won't say it because they don't want to look weak or vulnerable. There's a lot of pressure on them to make sure things are held down at the house. So, you know, it's definitely placed on them from an early age, you know. So I definitely see that a lot. And I definitely see a lot of Black men, patients of mine, dealing with depression and anxiety because of some of those pressures. They didn't get to live out their childhood the way that they wanted to. A lot of their childhood needs have been unmet because they were forced to be grown from a very young age. You know what I mean? So it's definitely a thing, definitely.
Yeah, I agree with you. It's a lot. That could be a lot of pressure on a young man. Some of them, if they feel that their mother is counting on them, then they might go out there and sell drugs, or they might go out there and rob somebody. You know, so I think that right there that can lead to a mental health issue.
Yeah,
right there in itself.
It definitely
You know?
can, and what I'm finding is obviously is like, instead of dealing with it in an appropriate way, they're turning to substances, they're turning to weed, they're turning to alcohol, and whatever other drugs that, you know, are popular on the streets. But that's really kind of a cry for help, honestly, you know. And I think it starts in the home and the schools, kind of paying attention to kind of what's going on to get more early intervention. But a lot of, you know, young people in our communities who are abusing drugs and alcohol at an early age, that's really a negative coping mechanism for them, you know, instead of, you know, being able to say, hey, you know, something's going on, let's talk about it, or maybe helping them find a service to kind of help with whatever's going on. They're just turning to things that are easier to get access to. It's easier to drink, easier to smoke weed than to sit there and talk about what's really going on. So I definitely notice that's definitely a thing.
Okay, so what are some of the ways that people can cope with anxiety?
All right, well, there's plenty of different ways. Like I always tell my patients, everyone's very different in terms of how they respond to different things. I would say, honestly, if you have the resources, that's another thing. That's a whole other conversation. But if you have the resources, obviously seeking some kind of mental health service from like a therapist. Sometimes talking with people is suffice. For some people, they require a little bit more in-depth type of therapy to deal with the issues that they have. You do really want to find out where the anxiety is coming from. It's not always easy to pinpoint. Sometimes, you know, if there's some childhood trauma in the mix, a lot of people, they suffer from PTSD and have no idea. You know, sometimes people think that you have to experience something super traumatic in order to have PTSD, but it could be something really simple and it could be traumatic to you. So definitely going to therapy is a big one. I tell people all the time, therapy saved my life. I advocate for it. I do. Something as simple as that. You know, we don't always have to turn to medication. And I think sometimes in my role, my friends will joke with me and say, hey, now you're a legal drug dealer. And like, I laugh about it, but at the same time too, I'm one of those providers, I'm very on the holistic route. I want to see what your lifestyle looks like. Maybe your diet can change. Maybe the things that you're watching change. Maybe the people that you're hanging around can change. Let's try and like do different things first before we resort to using medication. And that's not to say that medication doesn't work. Some people do need it. They do. But I want to see what your whole life is looking like and the things that you're doing on a day-to-day to try and help yourself to kind of help with reducing the anxiety, whether it's exercising, meditating, using some essential oils. It's a lot of different tools that you can utilize to kind of help cope with the anxiety.
Yeah, it's I was reading something the other day, and it was talking about how it's important to get your lab work done, your blood work done, the thyroids, getting those levels checked out.
Look at
Can you
you.
just talk about that? Yeah, I did my research.
Good. Yeah, no, that's definitely a big one. For me, with my patients, I always ask to get blood work done first before I start anything. I know some people are quick to be like, you're depressed? Here, take this. It could be something medical going on. How can you know that if you just start putting people on medications without seeing what's going on first organically? So like what you said with the thyroid, if your thyroid is high, and have hyperthyroidism, you can have symptoms that look like anxiety. If your thyroid is low, it can give you symptoms that look like depression. So sometimes that might be the fix. Sometimes you might just get medication or get treatment for the thyroid, and a lot of the symptoms that you're experiencing can resolve. Same thing with your vitamin D levels. Most people in New York, our vitamin D are trash. Trash, because we're inside all day, we're working. Me too, so your vitamin D level also affects your mood, your energy, your concentration levels, and all those things, along with other things that we look for in your lab work. So all those things are important to look at, because you want to make sure that all those things are where they need to be. And then we can look at how you're feeling, and then from there, figure out what the next best course of action will be for you. So it's definitely very important.
Wow. That's deep right there. Because I remember one time I was looking for some vitamin D pills, and I was more concerned about like what IU levels. I'm not sure if I said it the right way.
No, you are. The units. Yeah, no. Yeah. I typically recommend 3,000 to 5,000 units if you're under the normal range for vitamin D. Most people, they'll take like a multivitamin, which has vitamin D in it, but a lot of times the amount of vitamin D that's in the multivitamin most times isn't significant enough to really change the levels. So a lot of people don't know that. So they're taking their multivitamin, they think they're doing good, but a lot of times you need some more. So you need a higher dosage of the vitamin D to really see significant change within your levels.
Okay. All right. So you spoke a little bit about self-care. Like how important, just let the people know how important self-care is, going to the gym. I still haven't done this yet. Taking myself out at least once a week or once a month. I think that's very important.
It's so important. I do that. That's my thing now. I do it once a week. I go by myself. I don't need nobody.
That's what's up.
But self-care is everything. I know that word gets tossed around a lot on the internet and stuff, but it really, really is important, because I feel like, one, that's something our parents really didn't do. And I think that's over into how we know how to operate. I tell my friends all the time, this can't be the same 24 hours that my parents had, because I don't have no kids. It's just me, and I'm exhausted. Like, how did they do it? They didn't take no break, right? So, I definitely think it's important, because you get burnt out, you're gonna get overworked, and if you're constantly running, you're never gonna be able to let your body get the time it needs to kind of reboot itself. Something as simple as rest is self-care. People don't rest enough, Then I'm not saying you got to sleep all day, but why your body requires rest. You understand? So you need to replenish, and it needs time to relax, to kind of recuperate from the day of doing work all day. So I tell people, take some time to just sleep. You don't feel like going somewhere, listen to your body and just stay in. That to me is self-care. Setting boundaries with your friends, your family, your loved ones, that's self-care. It doesn't have to be this elaborate thing of, I'm going to the spa and I'm doing all of these fancy things that require money. Not everybody has access to doing those kind of things. So you do have to find things that work for you, that bring you peace, whether it's, like I said, going for a walk, taking yourself out on a date, a loved one, or just, spending time by yourself. But you can definitely try to incorporate those things, you know, throughout your week. Make it part of your lifestyle. The more you start to do these things, the more they become, you know, a routine type of thing for you.
Mm-hmm. Wow, that's deep. That's so deep. You spoke briefly about, you know, the medication, people taking it if they don't need it. Can you talk also about patients who are medication seeking?
Okay.
Have you ever come across that type?
Yeah, definitely have. Definitely have.
Okay. Okay.
Well, what do you want to know about patients that are medication seeking?
To the point where they feel like they need the medication to make them feel good at this point. Like they could be going through something, but it's like, I feel like this is something that's a therapeutic issue. So they're like, you know, number one, the medication could be hurting their insides, that type of thing, or just abusing the medication.
Okay.
Because some of these patients, they look at it as a legal drug.
Right. Right.
So they might act up a certain way. They might do certain things just to get the medication.
Right.
So do you feel like they should have gotten like more do you feel like they should have gotten more therapeutic attention in the beginning instead of just throwing the medication on them?
So, like I said, everyone is very, very different. What I will say is there's some providers who do things the right way, and then there's some that just kind of just do what they got to do. At the end of the day, you know, healthcare is a business. So you will have some people that will get seen by providers that they're in and out, you know, because they see patients as a dollar sign. You know what I mean? So it does make it challenging when certain patients are told certain things or given certain things from the beginning. And then when you try to get them, it's kind of hard to get them off of it because they've already gotten used to certain things. So like, like when it comes to stimulants, let's say something like an Adderall, that's a really popular one. Everyone's kind of heard of Adderall or dabbled with Adderall at some point throughout their college career or something like that. Let's be honest.
Okay.
But yeah, that's one that's I think is overly prescribed to a lot of people that don't per se need it. You know what I mean? So I guess how I kind of combat those type of things, I do a lot of education. I teach them about, you know, the pros and cons of the medication, what it'll look like for them long term. And then I give them options. And I really do a thorough assessment because a lot of times people will think that they have one thing and it could be completely something else, something different, but no one took the time to really dig deep and to ask more questions. They just went with what the patient said and went with that. And now they're on this medication. They feel like they need it. So I think with social media too, with a lot of like TikTok and things like that, with a lot of like information floating around, people see things online and it resonates with them and they go and they ask for something and they get it. You know,
gotcha.
A lot of people come to me saying, oh, hey, I saw a video on TikTok and I think I have ADHD. And what a lot of people don't know is that a lot of the symptoms of like ADHD and anxiety, they overlap. So unless you really dig deep and try and figure out really what's going on, you're not going to know. And if you just give them something to treat ADHD and they don't really have ADHD, it's not really going to solve their problems. It might be a little temporary fix, but there's something greater at hand that needs to get addressed. So that's how I kind of deal with medication seeking people. If I have an inkling that someone is, you know, really like abusing something, I'm going to make it a little bit more, I guess, harder for them. I'll ask them to do some extra steps. Give me a drug screen. I want you to do like a urine tox for me so I can see that. I want to see your lab work. There are systems in place for us as providers to check where we have access to something called iStop, where we can see any controlled substance that you've been prescribed by any provider within New York State. So we do have access to that. And if we see that, obviously you've been shopping around, getting prescriptions in a bunch of different places, that's also another red flag. So there's various ways to kind of, I guess, deal with that and manage those situations.
Okay, awesome. Thank you. How do you, what are some of the ways that you can spot anxiety in children?
Oh, yeah. So that's definitely a big one. And I think people are kind of starting to pay attention to that a little more. The thing with anxiety and even depression in children, it doesn't look how it looks in adults. So
gotcha.
in children, it could be something as simple as, you know, maybe like them not wanting to go to school. And you know, in our culture, in our community, like, you know, when a kid is acting up, we'll label them like, oh, you're lazy, oh, you're this, instead of actually trying to figure out really what's going on. Anxiety in children can be they cry a lot of temper tantrums, being really irritable, maybe not wanting to eat their food. It looks different than how it does in adults. So it's kind of hard, I guess, to spot if you're not looking for it. But that's where the education piece kind of comes in, especially with the parents. And also I put that on the educators, you know, for the people in the school, the teachers. They spend a lot more time with people's kids than people spend with their kids, honestly. So they're important in being able to recognize that something is off or is not right. You know what I mean? And you really do got to sit down with your child and have a conversation and learn how to communicate on terms that they understand and, you know, can feel comfortable talking to you about. And I just think that within our communities, especially me being Haitian, there is no such thing as talking back with your parents or communicating with your parents. I didn't have that. You know what I mean? Whatever you had going on, it was don't talk back. This is what it is. Yep. So again, it's a fine line, because I feel like I get into that conversation of, oh, kids these days are soft and blah, blah, blah. And they shouldn't have all these options. And then it's, well, this is also another reason why a lot of kids have anxiety and depression. And, you know, if we had intervened sooner, maybe, you know, we could have avoided certain situations or avoided some of these kids taking their lives. So I think for us as a community and within our culture, we do have to find this place of balance in between, where it's not that we're just, you know, all into their feelings 24/7 and we're not being good parents, but also, you know, finding a soft place in between both.
Makes sense. I know we got some parents watching. I got a couple more questions for you, okay? So can you explain the hypnotherapy process? Did I pronounce it right?
Oh, the hypnotherapy process?
Hypnotherapy, yeah.
So that's a little bit
I'm learning.
That's a little bit more of a more progressive type of therapy. Not all providers are certified to do it. It's something you have to go take a class and get certified in. But it's just an alternative form of medicine. Just how there's plenty different types of medicines that you can approach without having to resort to medications and things like that. But essentially, it's guided meditation. It's guided meditation that allows you to kind of just relax and to be in a space where you're able to more fluidly talk about things. I like to mix it in with regular therapy. And it really depends on the individual. Some people aren't receptive to it and some people are. But that's really essentially all it is. It's really a guided meditation that you're doing with a professional who's able to kind of walk you through it, allow you to kind of relax and to be more open to talk about different things and to access different parts of your subconscious.
Yeah, it's good that, you know, we have different options other than just medication and things of that nature. And one of the things that I'm aligned with is just body to body intimacy. You know, getting a hug,
right?
Those different things. Having a mate. Can you just let people know, like, because I was actually reading in your timeline, and you were saying how having a healthy sex life or a non-sexual intimacy can improve your mental health.
Oh, definitely. That's one of our basic human needs is love. Yeah. You know, love is definitely something that's very important, and people need it. Having a healthy sex life in a relationship is definitely has many benefits, as you can see from that post that I posted up. When you have sex, it releases feel-good hormones. You know what I mean? If you're having sex in a healthy way and, you know, yes, in a safe way, obviously. But it definitely, you know, it creates intimacy within your relationship. It builds trust. And it definitely makes you feel good. It's a form of exercise, it's some cardio. There's definitely a lot of benefits to it, not just physically, but mentally, because like I said, it definitely releases feel-good hormones when you are doing it in a safe way. And, you know, when you and your partner are able to engage in those type of activities together, it definitely just creates a stronger emotional bond between you guys.
Yeah, just being able to be held and being able to talk to each other and just have those moments, those awesome
No, you
moments.
have to know your partner too, because everyone is different, and that might be
Mm-hmm.
how you like to receive love, but not everybody
Mm-hmm.
receives love in that same way too. So you do have to take
Mm-hmm.
time to kind of explore those things with your partner and learn
Mm-hmm.
what their communication style is, learn what their love language is, because that
Mm-hmm.
will allow you a space where you guys can just relate better and have less disagreement, especially in those arenas, if you guys are able to really understand and recognize what someone needs and wants versus what your needs and wants are.
Mm-hmm. This is beautiful. I'm glad that you was able to be to open up with us and say that you even experienced having seeing a therapist. I myself have seen
Oh,
one too,
mm-hmm.
and I think it's something that, you know, we shouldn't look down upon, and it only makes us better people. It only gives us the information that we thought we didn't have, thought that we had, but
Mm-hmm.
now we're hearing, you know, because that therapist is not being biased,
Right.
you know. So I honestly feel like that's something that's underrated.
Listen, if your mental health provider has never been to a therapist before, I don't know. I'm gonna question that, because how can
Wow, I see.
that's just me just chatting, but
No,
how,
no, I feel you. Yeah.
you know, one, know what it's like to tell your patients about it, you know.
Mm-hmm.
That's one thing. Two, we pour into people all day, every day. Like, I work today from 9 a.m. to 7 p.m. all day, pouring into people, and hearing
Mm-hmm.
people's stories, where they've been, how they grew up, traumas that they've experienced. You got
Mm-hmm.
to make sure that you are good. You know what I mean? Because those things will get to you. So I do think it's
Mm-hmm.
important for people in the mental health field to get treatment themselves,
Experience that.
to make sure you're proactively making sure that you're okay, because
Mm-hmm.
people don't realize how mentally exhausting it is to work in the field. So I definitely always advocate for therapy. My friends who are in the field, I'm like, yo, go talk to someone.
Yes.
You know, even my parents, I think they're a little bit even more now open to these conversations, although, you know,
Mm-hmm.
I have Haitian parents. But I
Okay.
think the idea of therapy is definitely getting to be more of an acceptable thing for people, especially within our community, especially seeing people of color in
Mm-hmm.
the field, and then more people of color talking about their experiences with therapy. So I definitely highly recommend, for sure.
Yeah. Yeah, that's like a trainer who's never had a trainer. You understand what I'm saying? Like, it don't make sense. It don't make sense.
Exactly.
Okay. Okay. All right. Listen, Valerie, I want to thank you for coming on, and we're going to talk, you know, furthermore, and have some more discussions, do some other types of platforms and things moving forward. Okay.
Sounds good. Thank you for having me. Appreciate it.
Awesome. Awesome. Thank you. I appreciate you. All
All
right.
right.
Have a
Good
good
night.
one. All right.